Oh, here we go. Sorry. Hi, it's Rita at Travel Nurse Channel. It's Friday afternoon, 12:30, and I'm so happy to talk to you again today. And you can find me here at Travel Nurse Channel on Facebook every Tuesday and every Friday at 12:30. Between 12:30 and 1:30, I'll be here talking to you about all things healthcare related. And you can tune in, you can ask questions, make comments, concerns, suggest topics, add to the day's topic, which today, last time, Tuesday this week. What's today? The 7th? I believe, August 7th. So on Tuesday of this week, which I believe was the 4th, I talked about stress and how to recognize it. Is it normal? And, you know, when to recognize when it's getting out of the normal range and so forth. And so I thought, for balance, today we talk about good times. Good times. Yes, good times. There can be good times at work. And some stories, travel nurse stories, healthcare nurse stories, how you get there, you know, what makes your job, your ordinary everyday experience, what makes it extraordinary, either for you, for your patient's family, your coworkers, your supervisor. You are part of this team, and with regularity, they've created awards. Actually, the Daisy Award is for those, addresses that exactly, for nurses that go above and beyond, that are practice so not just professionally, but reaching out and being awesome listeners, reaching out and making a difference. And so we'll talk a little bit about that Daisy Award. We'll talk a little bit about Tulip Award, which is for techs and allied. So again, people that touch people, people that make a difference, people that take ordinary things and create an extraordinary experience for others. Okay, so let's just go with stories, okay? I'll tell you some of mine. I always tell you some of mine, and I've had some very, very funny ones in the latter part of my career. When I was employing a lot of nurses for per diem and travel assignments, I also could not fill this one position. For months, I was trying to find a nurse for this cath, cardiac cath / interventional radiology unit, and everybody was busy, and I couldn't find the right person to fill it. And I thought I'd love to do it. I had some cardiac cath experience, not so much interventional radiology, but it was a wonderful, wonderful experience. And I stayed in that area per diem for quite a few years and met really wonderful techs and nurses and doctors. And so a lot of funny things happen when patients are coming out of anesthesia. And one thing that comes to mind is not funny, but you know, you're serious. The work you do is quite serious. And if I'm, you know, providing conscious sedation, I am really focused on doing just exactly what's perfect for that patient and communicating a lot with the techs and the doctors as the procedure goes on. You know, are we winding down? You know, are we, you know, we may be 30 minutes into it, we may be an hour and 30 minutes into it. So you want to know, you want your patient to do well during their procedure. And this patient was seemingly not snoring and starting to wake up. And I think I checked in with the doctor and the techs, and I'm going, should I let her start to wake up, or do we want more sedation? And just as I was quietly, because when people under conscious sedation or moderate sedation, there is a sense of consciousness, and they may likely not remember it, but they might. And so you're careful. I mean, you're professional. So I was asking, are we nearly done? Should I let the patient wake up? And she was sort of coming out of this dream state, and I guess remembering that she wasn't feeling well, and she just barked out. She goes, "Somebody just cut my throat. Somebody just cut my throat." And so, I mean, it was unexpected. And so the team that I was working with, there were about 4 or 5 of us. We all kind of try to hide that giggle. So going forward and continue to work with that team, and one team member in particular, a wonderful radiology tech, interventional radiology tech, and friend of mine, her name is Tony. Every now and then, things were intense and things moved fast and things moved efficiently, but every now and then she'd turn around and she would either say it or mimic, "Somebody just cut my throat." And it would just add such levity to our very serious work. So that's one funny that I experienced, and it's not, so we're funny people, I would say, in the healthcare world, because I think that just broke the tension of a serious moment and busy work schedule. So that's something that stays with me, and I can look back on with a smile. Another story is another nurse's story who worked in the colonoscopy department, and her patient was a police officer, and so everything very well, and the medication that they're using wears off very quickly. So when the procedure was done and the policeman was coming out of the procedure, he looks up and he says to the nurse, "So what's your story?" So he just went back to being a policeman immediately, but he was not fully conscious. Okay, so what do I want to say? Another story, some of them are just heartwarming. And I think that falls into the good times. Good times, we have some good times out there. You're with your patients. Okay, so I always think of this. We do not expect to see people at their best. We see people that are anxious, that are frightened, that are in pain many times, that are frustrated, that have had long sleepless nights because the hospital isn't always the quietest place, although it's important to try and get your patients the rest they need. The rest is very healing. It's not always possible. So we don't always see our patients at their best, and if we can be the patient, if we can listen, if we can be the one that makes a difference, you don't take it personally. We know that they don't feel well. We know that they may be in pain. We know that they may be frustrated and frightened and tired of being sick and tired of being asked how they feel when they don't feel well. So all you can do is be that awesome listener, and what story was I thinking? Oh, so I was thinking of a story about a grumpy patient with probably good reason to be grumpy. He had a lot of pain, and when the day nurse showed up, he had a laundry list of complaints, the main one being that he didn't get his pain medicine on time. So she listened, she heard, and she understood, and she made sure that was a priority for her shift that day, was to make sure he got his pain medicine on time and that he was heard, you know. She didn't need him to say, good morning, have a nice day. She needed to hear what he had to say. And at the end of her shift, she felt like she made a difference. She's not sure she made him happy. She's not sure he would come back and, applaud her, but she knows she gave it her best shot, and she gave him what he needed at that time, which one was an ear, and two was pain treatment in a timely manner. Another story I'm going to tell you is about a patient that it was not the nurse's patient. It was someone else's patient. But she happened to come by and see that this patient was, maybe it was on a ward. So there was more than one patient, and that was not her patient. But the body language, the grimacing, the moaning, all of these things. And she said to the patient, "Are you okay?" No, the patient could barely speak. They were in so much pain. So she made it her business to meet, and she was an RN. She made it her business to immediately go find the RN and the doctor for that patient and get them the help she needed. And so it doesn't matter if it's your patient. You're there to help. You're there to help improve health, right? That's a very rewarding, good, right, positive outcome, is that that nurse found the time to get that patient what they needed. Like the other nurse got the patient the pain medicine, this nurse brought a distressed patient to the attention of his nurse and doctor and got that patient what they needed. Another story, I got this from a website. I can't remember, but if you Google good times for nurses or something, numerous sites come up from nurse.org and numerous sites. And this story was about a nurse that worked at Stanford, I believe, at Stanford, one of the hospitals up there in Northern California. And she was a relatively new nurse practitioner, actually, and had about a year and a half under her belt. And a farmer came in pretty much distress. I'm wondering if it was an urgent care. But at any rate, he doesn't know who he's getting when he gets a nurse or a doctor, whether they have 10 years or 1 year or 2 years, whatever. He had an accident with a tool or some farming equipment and had a big towel wrapped around his hand and was not in a good place. And she was the nurse practitioner to take care of him. And he took it off, and she was pretty devastated by his laceration. It took her over 2 hours to get the bleeding under control and get the stitches in and take care of him. And her happy ending to her story is that, that she did a good job, that she made it through, that she didn't express, I'm new to this, I've only been doing it for a year and a quarter, whatever. She just did what she needed to do, took care of that patient, got him out of there in a safe manner, all stitched up and so forth. And he came back a few weeks later to tell her how great his hand was doing and how grateful he was, and brought her a puppy from his farm. I love that story. I do love that story. So the moral of that story is she did not let fear stop her for doing an important job. And I really, really like that story. Okay, so I said I'd talk about the Daisy Award and the Tulip Award. These have been around for a while. Good times. Good times. We're talking about good times, people. And the Daisy Award and the Tulip Award, you can read about them. There's a very detailed review that takes place, and a lot of travelers, because I was after All-Star Staffing, where I created All-Star Staffing, and I did a lot of per diem and some travel and pre-bookings and all kinds of things for many, many years. All-Star Staffing was established in 1995, I believe, around there, 1995, I believe, and went on for many, many years. And then I sold it, and I stayed on as a nursing director, and then that went on till about 2016. So many, many years, right? From 1995 to 2016, I've been involved with nurses and their stories and so forth. And somewhere in that period of time, I found out about the Daisy Award. And then a few years back, maybe in 2018 or something, I found out about the Tulip Award. And I'm so glad about that, because we don't do it alone. Nurses don't do it alone. Doctors don't do it alone. So the techs and the allied and the therapist, and it's a team effort, really a beautiful, a well-oiled machine that really works that way sometimes, most times, honestly. And so I think at the base, at the very base of what makes that nurse or tech go from doing ordinary things to creating an extraordinary situation that gets recognized with one of these awards is this. I think they see their patient. They really see, or the patient's family, because they're in as much need of comfort and understanding in desperate situations as the patient. So you really just don't treat, if somebody has a shoulder problem, you're not just treating the shoulder, you're treating the person. You're treating the psyche. You're treating, must be dry in San Diego. I'm so dry. And I haven't drank much fluid since my coffee this morning. And here it is. What time is it? Let me not take up too much of your time. Okay, it's 1:45. Okay, so that's the thing. You see your patient, and beyond seeing them, you become attuned to them, attuned to what they're saying, attuned to what they're expressing in their body language, in the tilt of their head, and in the lines and the grimaces, and in the going from difficult to comfort. And in doing that, you make a connection. And some people are really good at that, making that connection, being tuned into others. And particularly when they're in a healthcare situation. And some people are quite natural at it for whatever reason. Some people are natural at playing a piano, So some people are just, they do that. They see, they recognize, they absorb, they connect, and so this Daisy Award was created in the community. I really don't know the history of the Daisy Award. I think I did once, and it escapes me now. Maybe we'll talk about it again. But the Daisy Award is really something special. And you become an honoree for life. You'll always, it's almost like if you have RN after your name, or RT after your name, or PT after your name, and you get a Daisy Award or a Tulip Award, that goes with you. And it's a beautiful thing. And if you're not, okay, so I am not a famous pianist. I could barely, tinkle out a few things. And that's only because I used to play an accordion. So keyboard thing was familiar to me. But I am a simpatico person. I am a compassionate person. And I love, love, love being a nurse and connecting with human beings. And I'm not a Daisy Award winner, unfortunately, but I totally, totally respect the award and the Tulip Award. And the point I want to make about it is that if you're not a natural, if you're not a naturally, if connecting doesn't come natural to you and certain social situations don't come natural to you, it can be learned. That's what I want to say. It can be learned. I'm not seeing any viewer comments or questions, but you can. When we're live, I'm fixing something that just came apart on my shoe down there. Sorry. You can always check in on Facebook. We're on Facebook, and every Tuesday and Friday, as we are right now, and you can ask questions or comment. Just go to Travel Nurse Channel on Facebook, and you can comment or ask a question or make a comment or a suggestion. And hopefully I can respond and give you an answer if you have a question. If not, I will respond, do my research, and get back to you the very next session. So, but all of you wonderful people may be working or busy or multitasking or whatever, but just so you know, I just want to remind you of that, and I really do appreciate hearing from everyone. But what I wanted to say about these Daisy Awards and about this important piece, this attuning to patients, to really seeing your patients and hearing your patients and being attuned and reflecting and wondering how you can help and who can help if you can't help, and all the things that you do. And it reflects not just on you and your patient relationship, but you and your patient's family relationship, and you and your coworkers, and you and your supervisors. It's a wonderful gift to be able to attune and to continue to wonder how you can do better and how you can tune in and so forth. And so it is my point. I eventually get to my point, and connect with patients and all of that. And if it doesn't come naturally to you, just like playing a piano, it can be learned. It can be learned. You can learn to, if you see someone that you think is doing the same old things that we do in our practice, but that there's something special about them. There's something, they seem to connect so readily and easily and pick up on things that you may have missed or whatever. And you reflect on it, you think that's where I want to go with my practice. You can. If you continue to wonder how you can do better, if you continue to reflect on what worked and didn't work, if you continue to develop things that aren't easy for you. So for me, math was never easy. English was easy. Science was easy, interestingly, but math was not. So you can learn. You can, and piano was not. The accordion was, but I didn't have a piano. Maybe that's why. Oh, there I go. Getting itchy. I'm going to let you know that every time I touch my face, I wash my hands, because I'm just not sure I'm going to remember the second I leave the office. So I want to be clean out there for my family members and people in the community. Okay, so so some people, it's a natural ability, and they will see what works, and they will recognize how they help others. And oh, somebody's chiming in something, and they master it. but I want to say that you can master it too. So I am hearing from somebody who says, we always have different patients most days, but there are times when I have the same patient ICU for several days. Yes, yes. And continuity of care is a fabulous thing. I understand that, Anonymous. Yes. Yeah, particularly if you're working 12-hour shifts and you do 2 in a row, and you're really making a connection with a patient, your charge person, your charge nurse or charge or supervisor in what area, whether you're a tech or a nurse, will try to continue that continuity of care, particularly if the patient said, oh, Nurse Nancy, is she coming back? She helped me so much yesterday. So continuity of care is a fabulous thing. And on the flip side of that, it's actually a positive thing for a patient. And I've said that, like when I've had a good connection with a patient and they're going, will you be here tomorrow? And I'd say, no, actually, tomorrow I will be somewhere else. But we have lots of good people that will help you. And the positive flip side of having another nurse or tech take care of a patient that felt connected to you is that they can benefit by another set of eyes and ears and hands and knowledge base. So as wonderful as it is to connect with a patient on more than one shift, on more than one occasion, it is actually can be a very positive thing to have a new nurse or someone connect with you. So there's that. So yeah, those are my stories. I have some funny stories, and I think that's we want to get back to good times, like the policeman waking up from his anesthesia and going, okay, so what's your story? I found a couple of ones here. What is this? This is from a site called the Business Insider, and they're funny, and some of them are, I don't know, they don't have dates, so I think some of them, that cop one I think was cute, because I just feel like nurses are kind of always on the job with their families and their neighbors, and whether they're on the clock taking care of patients, like the minute people know, this happened to me a lot over the years, they know that I'm a nurse and they want to know where I worked and if I was working in the ICU, the cardiac unit, or if I was a dialysis nurse. They immediately like relate. They're like, oh, I remember this one older man one time who goes, you're a nurse? Do you work in the ICU? And yeah. And he pulls up his shirt to show me his cabbage scars at a party. He was the grandpa at this party. What a character. Anyway, so another thing is people often, early in my career, I never thought I heard so much about people's bowels. They like to talk about them. So, oh, this is this one surprises me. And the nurse that signed off on it, her name is Nancy. I use that. I don't know why Nurse Nancy, it just kind of rolls off the tongue. I use Nancy a lot. But this is actually a story by Nancy. They were getting a lady ready for her surgery, and she was embarrassed, but told one of the nurses that she had an orgasm every time she got an IV started. I don't know. Her orgasms are related to fear or something. I don't know what that's all about. And there I am touching my face again. But anyway, so knowing that, nobody wanted to be the one to start her pre-op IV for her surgery, but one nurse volunteered to do it, and she was really motivated and got it in one stick. So there you go. That's a silly story. I don't know. I'm not even sure I believe that, but a surprise story, maybe so. I thought there was one cute one here, not labor and delivery. Oh, I thought this was so funny. So an older man, like a 90 plus something, had a colostomy, and the nurse needed to change it. It's part of a job. Sometimes that's a wound nurse, depending on the hospital, or sometimes it's the med-surg nurse. It just depends. And she said that it was so foul-smelling that her eyes were tearing. And she tried to be really professional, tried to have her, like, poker face going. And the, the patient, when she takes off the bag and this thing is so smelly, goes to her, God, you have bad breath. Maybe he wasn't really, maybe he was a little disoriented or confused. So, but I read that one and I just laughed. Yeah, patients have no filters when they're talking to us, says one nurse. Let's see what her name is. Oh, I don't see. Okay, here's a labor one. Let's see. Oh, yeah. Okay, so this one lady is in labor and she's fully dilated and she started pushing. And then she said to everybody in the room, I've changed my mind. I don't want to do this. I'm going to leave. And she tried to get off. I think she used a curse word. I'm going to F blank 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 leave. But tried to get off the gurney or the bed or whatever. That one I totally believe. I don't want to talk about bowel movements. We already talked about a colostomy, so we're going to skip that. That's something about apple juice. Let's see. The patient was waking up. I don't really get this one. A patient is waking up after surgery and was annoyed when I asked him how he was feeling. I continued to ask him if he was hurting because he was just going around in circles about it's not fair, it's ridiculous, this is ridiculous. And then he looked me square in the chest and states, I haven't even looked in the refrigerator yet. He was obviously still under some kind of sedation. He wasn't. Okay, one day I was running around trying to get supplies for one of my residents who was coding. Running around. His wife stops me as I head back to the room and says, oh, he's just faking. He's been talking about finding some way out of this hellhole. Just slap him hard a few times and he'll wake up. Oh, dear me. Okay, anyway. There's a million stories. I don't know why I keep scratching my face. What does that mean? I know when you have itchy hands, you're going to get money. And I don't have itchy hands. I have itchy face. I think I'm dry. So, folks, I love talking to you. I want you to remember to have good times. There are good times. There are stressful times, but there are good times. So I wanted to balance out because last time we did talk about stress. And then attuning, seeing your patients, attuning to your patients, those beautiful connections, and then the beauty of somebody recognizing it. You know, most of us don't do what we do for recognition. It's our job, it's our profession, it's our livelihood, but it is nice to be recognized. And the Daisy and Tulip Award, I think there's another award too, something about a petal. And then I think there's special awards for leaders under the Daisy Award and so forth. So there's a lot more to it. We can talk about that another time. But the Travel Nurse Channel is here for nurses, for those who employ nurses, for CNAs, LVNs, RNs, nurse pracs, PAs, PTs, OTs, speech pathologists, rad techs, respiratory therapists, CT scan techs, and MRI techs, and all of you beautiful, wonderful, funny, extraordinary people. We are here for you. I'd love to hear from you, whatever wherever you fall into that category, if you are a nurse manager, if you are a recruiter, if you are run a healthcare clinic, if you run a surgery center, we're here for you. It's a nominal fee to advertise. I think it's $27 a month. It's really a great way. We have thousands of people and hundreds of people viewing Travel Nurse Channel, and super easy access on Facebook and YouTube. YouTube would be a great place to go to watch a lot of older videos that we've been doing. We've been doing this for many months. So if you missed something, or you just want to see if something interests you as much or more than today's, go for it. And then thank you, Anonymous, for asking about most days having different patients, but are there times when you have the same patients? And that's a yes and a yes. Most days you do have different patients, and yes, sometimes you have the same patient. Particularly, there are some long-term patients, like COVID, for example, in the ICU, and so that opportunity to take care of the same patient repeatedly does arise, and is a real positive if you're making a good connection. And it's wonderful when you make a connection. You often wonder, I wonder how they did. I had a lot of repeat patients when I was first a dialysis nurse, and tried to keep up with some of them. And I often wonder, because I go back, I was so young then, and I was in a different state. I started my career in New York, and then I've been in California for many years. So like 30-something years. Lots of years here. So I often wonder back to some of the patients that I connected with back in the day, in the 70s, late 70s I became a nurse, how they're doing. And would like to thank them for being my patient. Anyway, it's Rita King here, signing off. Have a beautiful weekend. Have some good times. Have some good times out there, people. It's great to see you. And I hope I have a date to speak with a super duper orthotech that I worked with years ago. He worked for my company, All Star Staffing. And so we're going to try and connect over the weekend, and then hopefully I can share that, his stories, his wonderful stories with you on Tuesday. That's the goal. That's the goal. I'm going to try and do that. And I haven't done that. I've had a lot of live, people speaking with me on this site, but I haven't done it where I can record it and share it with you. So I'm looking forward to that. Thanks, everybody. Take great care, and have some good times.